Section 5. 1. Blank is term for measures practiced in healthcare facilities to prevent and control the spread of disease. A. Medical asepsis. B. Microbes. C. Infection control. The answer is C. 2. A blank is a living thing or organism that is so small that it can be seen only through a microscope. A. Virus. B. Section 6. 1. Which of the following includes our five senses? A. Sight and hearing. B. Touch and smell. C. Taste. D. All of the above. The answer is D. 2. Blank is the loss of ability to move all or part of the body. A. Fracture. B. Paralysis. C. Sprain. The answer is B. 3. It is very important to try to prevent accidents before they occur. A. True. B. False. The answer is true. 4. A fracture is A. A broken bone. B. A bleeding bone. C. A severed bone. The answer is A. 5. What fracture causes the greatest number of deaths and can lead to severe health problems? A. Shoulder. B. Leg. C. Hip. The answer is C. 6. The following factors increases the risk for falls except A. Poor lighting. B. Upholstery. C. Slippery or wet floor. D. Throw rugs. The answer is B. 7. Blank means confusion about person, place, or time. A. Orientation. B. Disorientation. C. Identification. The answer is B. 8. Never lock a wheelchair before transferring a resident into or out of it. A. True. B. False. The answer is false. 9. What can be caused by dry heat? A. Burns. B. Cuts. C. Scalds. The answer is A. 10. Scalds are burns. A. True. B. False. The answer is true. 11. Blank can occur when eating, drinking, or swallowing medication. A. Poisoning. B. Gasping. C. Slippery. D. Choking. The answer is D. 12. Residents must be sitting up straight when eating, whether in a bed or a chair. A. True. B. False. The answer is true. 13. And blank is an injury that rubs off the surface of the skin. A. Abrasion. B. Cut. C. Scratch. The answer is A. 14. Blank means the process of burning. A. Flammable. B. Smoking. C. Combustion. The answer is C. 15. Which of the following requires that all hazardous chemicals must have a material safety data sheet? A. MRSA. B. HIV. C. OSHA. The answer is C. 16. Which of the following are examples of physical restraints? A. Mitt restraints. B. Belt restraints. C. Side rails. D. All of the above. The answer is D. 17. Blank is death from a lack of air or oxygen. A. Suffocation. B. Atrophy. C. Syncope. The answer is A. 18. Understanding some basic principles of body mechanisms will help keep you and residents safe. A. True. B. False. The answer is true. 19. Blank is the way the parts of the body work together whenever you move. A. Posture. B. Center of gravity. C. Body mechanics. The answer is C. 20. Always try to catch a falling resident. A. True. B. False. The answer is false. 21. Where does the center of gravity in your body point? A. Where the most weight is concentrated. B. Where the least weight is concentrated. C. Where no weight is concentrated. The answer is A. 22. The wider your support, the more stable you are. A. True. B. False. The answer is true. 23. A blank moves an object by resting on a base of support. A. Alignment. B. Lever. C. Counter of gravity. The answer is B. 24. When you stand, your weight is centered in your pelvis. A. True. B. False. The answer is true. 25. Do not twist while you are moving an object. A. True. B. False. The answer is true. Section 7. 1. The first thing to do when you recognize a medical emergency is A. Turn on the AED. B. Do nothing. C. Assess the situation. D. Start CPR. The answer is C. 2. Which of the following means being mentally alert and having awareness of surroundings, sensations, and thoughts? A. Conscious. B. Breathing. C. Unconscious. D. None of the above. The answer is A. 3. Checking a person for injury includes all of the following except A. Medical alert tags. B. Applying restraints. C. Severe bleeding. D. Changes in consciousness. The answer is B. 4. Blank is an emergency care given immediately to an injured person. A. CPR. B. Abdominal thrust. C. BLS. D. First aid. The answer is D. 5. To open the airway, you should use the A. Head tilt chin lift. B. Chin lift head tilt. C. Both A and B. D. None of the above. The answer is A. 6. When giving CPR, the correct rate of chest compression Section 8. 1. Which of the following is the correct order of Maslow's hierarchy of needs? A. Self-esteem, belongingness, self-actualization. B. Safety, physical needs, love and belongingness, security. C. Self-actualization, self-esteem, belongingness and security. D. Physical need, safety and security, love and belongingness, self-esteem and self-actualization. The answer is D. 2. Considering a whole system such as a whole person rather than dividing the system up into parts. A. Holistic. B. Mental. C. Independence. D. None of the above. The answer is A. 3. Which of the following is not a basic human physical need? A. Safety. B. Food and water. C. Getting an iPad. D. Comfort. The answer is C. 4. A loss of independence can cause which of the following? A. Depression. B. Poor self-image. C. Feelings of being useless. D. All of the above. The answer is D. 5. Blank means to touch or rub sexual organs in order to give oneself or another person sexual pleasure. A. Mensuration. B. Masturbation. C. Menstruation. D. Menopause. The answer is B. 6. A person who has a desire for persons of the same sex is called A. Transsexual. B. Bisexual. C. Heterosexual. D. Gay. The answer is D. 7. A woman whose sexual orientation is to women. A. Lesbian. B. Gay. C. Transsexual. D. Bisexual. The answer is A. 8. Spirituality means A. Relating to the spirit or soul. B. Relating to the mind. C. Relating to the way we conduct ourselves. D. None of the above. The answer is A. Fill in the blank. Atheists. Buddhism. Christianity. Hinduism. Judaism. Islam. 9. Believe that life is filled with suffering that is caused by desire. The answer is Buddhism. 10. Believe Jesus Christ was the Son of God and that He died so their sins would be forgiven. The answer is Christianity. 11. Believe in reincarnation, karma, and do not eat beef. The answer is Hinduism. 12. Pray 5 times a day facing Mecca, the holy city for their religion. The answer is Islam. 13. People who claim that there is no God. The answer is atheists. 14. Do not work from Friday sundown to Saturday sundown. The answer is Judaism. 15. Fasting means A. Eating vegan food. B. Eating soul food. C. Not eating food or eating very little food. D. None of the above. The answer is C. 16. Blank do not eat any animals or animal products such as eggs or dairy products. A. Vegetarian. B. Vegans. C. Ovo-vegetarians. D. Lacto-vegetarians. The answer is B. 17. A highly contagious viral disease that strikes nearly all children is A. Leukemia. B. SIDS. C. Ageism. D. Chickenpox. The answer is D. 18. Blank is a maltreatment including not providing adequate food, clothing, or support. A. Child neglect. B. Trauma. C. Premature. D. Disability. The answer is A. 19. School-age children age from A. 12 to 18. B. 3 to 6. C. 6 to 12. D. 18 to 40. The answer is C. 20. Blank is a form of cancer. A. Chickenpox. B. Bulimia. C. Leukemia. D. SIDS. The answer is C. 21. What is the study of health, wellness, and disease later in life? A. Gerontology. B. Geriatrics. C. Ageism. D. Cognitive. The answer is B. 22. The study of the aging process in people from midlife through old age is called A. Scientology. B. Geriatrics. C. Zoology. D. Gerontology. The answer is D. 23. Prejudice towards stereotyping against older persons or the elderly is called A. Ageism. B. Anorexia. C. Old age. D. Giantism. The answer is A. 24. Blank refers to disabilities that are at birth or emerge during childhood. A. Developmental disabilities. B. Down syndrome. C. Spina bifida. D. Cerebral palsy. The answer is A. 25. Spina bifida literally means A. Crack spine. B. Rip spine. C. Split spine. D. Age spine. The answer is C.